Hello everyone, my name is Shazwana Erna Binti Herman. I'm a year 1 medical student from UMS, and today in this video, I'll be talking about a specialty that I'm interested in, which is neurosurgery. So, what is neurosurgery? Neurosurgery is the medical specialty concerned with the diagnosis and treatment of patients with injury, diseases, or disorders of the brain, spinal cord, spinal column, and peripheral nerves within all parts of the body. The specialty of neurosurgical care includes both adult and pediatric patients. Okay, so now let's look at the brain anatomy. So the brain is the central organ of the nervous system, and it is responsible for controlling movement, sensation, cognition, emotions, and vital bodily functions. It is protected by the skull, 3 layers of protective membranes known as the meninges, and the cerebrospinal fluid, CSF, which cushions the brain and helps maintain a stable internal environment. So, anatomically, the brain is divided into 3 main regions: the cerebrum, the cerebellum, and the brainstem. So, the cerebrum is the largest part of the brain, and it is involved in higher mental functions such as consciousness, memory, language, and voluntary movement. Its outer layer, the cerebral cortex, contains specialized areas for motor control, sensory perception, and information processing. And then the cerebellum, which is located posteriorly, it plays an important role in coordinating movement, maintaining balance, and ensuring smooth and precise motor activity. Now the brainstem, which includes the midbrain, pons, and medulla, it connects the brain to the spinal cord. It regulates essential life-sustaining functions such as breathing, heart rate, blood pressure, and the level of consciousness. Alright, so now let's look at the nervous system. So the nervous system is the body's main communication and control network. It detects changes in the internal and external environment, processes information, and produces the appropriate responses. So our nervous system, it is divided into 2 main parts: the central nervous system and the peripheral nervous system. So the central nervous system, or CNS, it consists of the brain and the spinal cord. It is responsible for processing sensory information, coordinating responses, and controlling higher functions such as thinking and voluntary movement. Next, the peripheral nervous system, or PNS, it includes all the nerves outside the brain and spinal cord. And it connects the CNS to the rest of the body and allows communication between the brain, spinal cord, muscles, and organs. And then the PNS is then further divided into the somatic nervous system, which controls voluntary movements, and the autonomic nervous system, which regulates involuntary functions such as heart rate and digestion. So together, these components allow the body to function in a coordinated way. Alright, now let's look at nerve signal transmission. So nerve signal transmission is the process by which neurons communicate within the nervous system. So this is the structure of a neuron. It has axon, dendrites, node efferent, myelin sheath, cell body, yeah. So at rest, a neuron has a resting membrane potential of about -70 millivolts, which is maintained by the sodium-potassium pump. When a sufficient stimulus depolarizes the membrane to the threshold potential, which is approximately -55 millivolts, an action potential is triggered. So during depolarization, voltage-gated sodium channel will open, sodium ion enter, and the membrane potential will rise to positive 40 volts. And then the repolarization will follow, which the sodium channel will close, potassium channel will open, and potassium will leave the cell, which then returns the potential toward negative values. And then the hyperpolarization will occur before the neuron will return to its resting potential, which as the ion channel will reset, and the sodium potassium pump will also restores the ionic balance. So let's look at this picture. So at the axon terminal, the voltage gated calcium channel will open, calcium enter, and then the synaptic vesicle will release neurotransmitters into the synaptic cleft. And these will bind to the postsynaptic receptors, which will cause excitation or inhibition. And they are then cleared by reuptake, enzymatic breakdown, or diffusion. Yeah, so these are the examples of neurotransmitters. We have dopamine, which is for movement, acetylcholine for NMJ, glutamate for excitatory, and GABA, which is inhibitory neurotransmitter. Okay. Alright, now let's look at clinical diseases within the specialty, which is Parkinson's disease. So it is a progressive neurodegenerative disorder primarily affecting the motor system. It typically affects individuals over age 60, and it is characterized by the death of dopaminergic neurons within the substantia nigra here, which leads to a massive deficit in dopamine, which I said before, it is the primary neurotransmitter for movement. So clinically, we identify the progression of this disease using the TRAP acronym, TRAP, which is a tremor at rest, a rigidity, which is the stiffness in the limbs, akinesia, which is the slowness of movement, and P for postural instability. So while the diagnosis is primarily clinical, but based on a neurological exam and patient history, we often use the patient's positive response to dopamine medication as the diagnostic confirmation. So there are some medications like levodopa, dopamine agonists, MAOB inhibitors. However, when Parkinson's medication like levodopa loses its effectiveness, we have advanced technology, which is deep brain stimulation, or DBS. It is a surgical procedure used to treat disabling motor systems by delivering precisely controlled electrical pulses to specific brain targets. The system, it has three components. This is the tool. It has the LED, which is the electrode that is placed in the brain, the extension wire, and then the neurostimulator, or the IPG, and it is usually implanted under the collarbone. We typically target the subthalamic nucleus, or the globus pallidus interna. So actually DBS, it does not cure the disease, but it just modulates the high frequency electrical signals that causes the tremors and rigidity in Parkinson's disease. So now let's look at this outstanding neurosurgeon that I chose, which is Dr. Alan Louis Benabit. Yes, so he is a neurosurgeon and also a physicist. Wow, he's currently a professor emeritus at Joseph Fourier University, and the reason why I chose him is because he is actually the one that invented DBS. So in 1987, while performing a traditional surgery to treat tremors, he discovered that by applying high-frequency electrical stimulation, he could suppress a patient's tremors instantly. And for his work, he received lots of awards. For example, the Lasker DeBakey Award, and today his legacy will continue in the world of Parkinson's disease. So that is all for my video. Thank you so much for listening.